Me, my friend, that things started to get suspicious when the Medicare and Medicaid mechanisms noticed one medical bill here and 10 fake bills there. It was like a dark comedy being played out in the shadows. In late 2023, the investigative teams of the Department of Justice, the FBI, and CMS came together to form a sort of medical Avengers team. But instead of saving the world, their goal was to save the money of the swindled taxpayers. The team began analyzing millions of bills, like someone searching for a needle in a haystack. But this needle was covered in fake bills and fake company names. With each investigation, companies like Medical Home Care and Priority One Medical Equipment emerged, existing only on the internet, their invoices soaring into the air in the thousands of dollars. The team used all the latest tools, from big data analytics to wiretapping call centers where clients were requesting fake signatures with trembling fingers. In March 2025, the first raid took place on the headquarters of these shell companies. The suspects were surprised when the forces entered, like a scene from the movie The Fastest Fist in the West, only this time with the government's purse in their hands. Businessmen and doctors were arrested, and bank accounts were seized, moving at the speed of a Formula One race to banks in Malaysia and Hong Kong. At the same time, investigators continued to dig through patient files, collecting testimonies from elderly people who said, "How can I use a urinary catheter that I've never heard of?" And from mothers who mourned the loss of their children due to unnecessary prescriptions. By June 2025, the campaign culminated with the arrest of 324 people, including 96 professional doctors. Many of them believed they had successfully circumvented the system, but they forgot that justice always had a phone number ready to call. Billions of dollars were frozen, planes and luxury cars were impounded, and the stories of these fraudsters became television series in their own right. In the end, everyone learned that even the most successful actors on this stage didn't escape the camera, because the healthcare system, despite its holes, is always being watched. Can we laugh at this story? Maybe, but the stolen money certainly won't come back with a laugh. And this story was supposed to be told at a medical conference with the title, "A Model Healthcare System That Protects Citizens and Reliably Delivers Medicine." But the story came out with a completely different title, "How to Steal America, Only with Bills." Gentlemen, it wasn't a simple crime. Rather, it was a crime opera, each act playing on a theme. A forged signature, a DNA test that wasn't conducted, fake psychiatric treatment, urinary devices that weren't delivered. And the audience? An elderly citizen with a stolen name, a mother crying, a doctor boarding a private jet on his way to prison. Companies established in dollars and sold for hundreds of millions. Dormant bank accounts suddenly awakened to international transfers, more exciting than a James Bond movie. True, the judiciary began handing out judgments, properties were frozen, and some planes were taken off the hangar. But is this the end of the story? No, because the real victim here wasn't just the public budget, but something greater: conscience. That small voice that says to the doctor, "Fear God," and to the company, "Don't steal." But it seems everyone was wearing earphones and heard nothing. And so we close this file, a case that stole more than money from us. It stole from us our security, our trust, and our belief that white cannot be stained. Medicine remained silent, and crime spoke out. And that's the grand finale. The biggest Medicare scam in US history, officially exposed.